Very good evening, friends. Meeting again in the session of Organon philosophy, and we are discussing regarding the Stuart Close philosophy. We have started with the new chapter, that is the potentiation and the infinitesimal dose, where he tried to explain the scientific concept behind the infinitesimal dose, giving all references from the basic sciences, giving references of the physics, the chemistry, the biology, and correlating it in order to explain, yes, how this infinitesimal dose carries the scientifically medicine and properties as well as energy, and it is not a placebo effect. There are many comments which are passed on homeopathic medicines that it never contains medicine. How can it be? It is a placebo. But this is not so. And he is giving the explanation to you so that you can explain it to the layman and explain the concept behind that. It is not a placebo, it is really a medicine. And for that purpose, he is taking the help of Newton's concepts. He is taking the concepts from the basic science that energy neither be created nor be destroyed. It is converted from one form to another form, which is used in homeopathy while preparing the medicine. The second important thing which he tries to explain, one more, that matter is indestructible. That is one important law of physics, and this is what we used to use when we triturate or when we succus. We used to do the same thing again. That matter is indestructible and infinitely divisible. So this law again have used by Hahnemann while preparing the doses, and that's why with these concepts Hahnemann went ahead and developed the different scales. These are the medicines which are absolutely energy medicines. The science is not able to find it out. That is the limitation of science, but ultimately it carries the original particle of the medicine, which is invisible to your naked eyes. And that's why Hahnemann says, or according to the Avogadro's hypothesis, above the 12C potency or above the 24X potency, you cannot find it out any material medicine in the medicine. And because of which, after 12C potency or 24X potency, the medicine becomes absolutely dynamic. And we were on page number 216, last paragraph with which we have to start. Then, to the Newton, light consisted of perfect hail of these minute material atoms thrown up from the light producing body. In the exercise of his scientific imagination, he saw these little particles of matter flying up in every direction at incredible speed. Later came the conception of luminiferous ether. Physicists think now of a ray of light as the pulsation or vibration of an intangible substance, which act like solid but which lets ordinary matter pass through it without interference. He is giving the different examples of such minute things, dynamic things, the waves, the particles not directly visible to naked eyes, but which persist over there. And those matters, when persist and goes from one place to another place and find it out their existence, it itself suggests that even though they are not visible to your eyes, they are there. We can find it out, the light particles. There are many minute things which are there around us. But unless and until a small ray of sun comes over there, and then it visible, then you can visualize it. Otherwise, you can't. And such a thing happens. So, if even though it is invisible to your eyes, you consider they are present on the basis of cause and effect. In the similar manner, the homeopathic medicine, which is in a fine quantity, which is present over there, it is there. The marvels of electricity as developed in such invention as dynamo, the electric motor, the electric light, the telegraph and telephone, and later the X-ray and the wireless telegraph and radio have done much to incline men towards the acceptance of more spiritual interpretation of the universe. So it was a unique. Previously, when first time the radio came into existence, the people, they got frightened. They never understands how the noise comes from this box which doesn't, there is no one sitting in that, and still noise comes. They were frightened because they were not in a concept that such a energy which is catched by that transistor and then you can get the sound of it. It was very difficult to digest. The same thing has happened with the homeopathy. The concept of dynamic homeopathic medicine is not easily digested. When we run from material to dynamics, the things are not become so easy to digest. And then gradually we have accepted the condition of radio. Then the question of television came. Then after television, then televisions came with a connection. Then television comes. Now television you can observe over there in your mobile without a wire. Nothing is there, and still you can visualize it. What is this? This is nothing but the things which comes over there through the waves and which are invisible to your naked eye. He who accepts without question the operations of this invisible intangible force, the real nature of which no man knows, to say nothing of the phenomena of radioactivity, gravitation and chemical affinity, should not stumble over homeopathic hypotheses which he make and demonstrate for himself any day. So he is saying, if you are accepting such type of things which are invisible to your eyes, and then it is duty of you that you must accept the hypothesis in homeopathy. Even though the medicine is not there, still it works and it carries the energy, and that we have to understand. Magnet and magnetic energy, the magnetic force. We have seen many experiments, and the force is not visible, the energy is not visible, but still we have to accept it because we know there is a magnet on one side and another side there is a iron piece. In between medium, even though invisible to your naked eyes, it is present. In the similar manner, homeopathic medicine, which is prepared in with such a technique, either a trituration or a succussion, carries in it the properties of medicine. Carl Sinder, in New Conception in Sciences, points out how many advances in science and arts have been made possible by discovery of new mechanical appliances. That homeopathy was thus made possible has not heretofore been recognized. Sinder says, the phrase, the mechanical appliance, is used broadly as including all that may contribute to the exact measurement and to the extension of our primitive senses in any direction. In this sense, the calculus or the reactions of the chemist test tube must be reckoned as mechanical no less than thermometer, the microscope or the balance. It also includes such aids to the circulation as to use the zero or use of zero, the more strictly speaking of decimal system of counting, algebra, the inventions of fluxions, logarithms, and the slide rule. We have all heard the story of how Archimedes detected the alloy in the king Hiero's crown, how a certain weight of gold had been given to by the king to an artificer to make over into a crown, how the king, suspecting a cheat, asked his friend Archimedes if he could tell whether base metal had been put in with gold, how Archimedes, sorely puzzled and stepped one day into his bath, observed how the water ran over, forgot everything, and ran home naked through the streets of Syracuse, shouting, Eureka, Eureka. Archimedes' discovery was simply this, that a body in water displaces a quantity of water of equal weight and not according to its bulk, as one might believe in first thought. With it, he establishes the idea of specific gravity. By this, he not only exposed the tricky goldsmith, but was led to all sort of investigations and finally to the discovery of the lever. So he is giving all examples of the physical science. How these people came to the conclusion of certain laws, certain doctrine. It is only because they were fully imbued with the thoughts and they were working on it. Their working principle and experimentation ultimately led them to certain specific thoughts that led them to the inductive logic, because of which Archimedes have mentioned about all those things. The same thing has happened with the Hahnemann. He was imbued with his thought of law of similars, and he was working and experimenting and experimenting. He was working with the right direction. He was working with concept in his mind. Yes, if what happens if we reduce the dose? So he has started reducing the larger doses from allopathy to the gradually half of the dose every time, and still it was working. When he reached to the nearly about zero, still it is working, and then he started preparing the medicines by the scales and making it infinite. This is not one day. Within one day he got the answer. It took long period to develop and to reach to that level. So he is giving all references in order to explain or support the Hahnemann. In a similar way, Hahnemann, groping about in his study of action of homeopathic drugs on the healthy human organism, perplexed by the aggravations resulting from ordinary doses, seeking to find a dose so small that it would not endanger the life, and desiring to accurately measure his degree of dilution so that he might repeat or retrace his steps, invented and adopted the centesimal scale of menstruation. Immediately, he found ready to his hand the means of solving the problem in which so many others before him had failed. He had devised a process simple in extreme not, by which, with nothing more but a mortar and pestle and series of small glass vials and small quantity of sugar of milk or the pure water or alcohol, he could not only modify the toxic substances so that they were rendered harmless without destroying their curative process, but develop and measure the inherent latent medicinal energy if inert substances to any extent desired. So it is not within a day Hahnemann have developed all those things. It took Hahnemann for longer time of period, where he started reducing the doses gradually, day by day. And when he reached to certain level, then he started diluting the medicine. Then not only diluting, then he has added this. If we apply the force, what will happen? Then he has developed the method of trituration, again with mathematics. And then he thought that what about the liquid substances? And he derived one more method of a dilution and potentization by the method of succussion. So everywhere he has utilized his scientific mind along with the application of the physics, application of the chemistry in preparing the medicines and making it more and more fine. So this was a unique thought with which he has started, with which he has gone ahead. And what he says, substances which were entirely inert. This paragraph is very important. Substances which were entirely inert physiologically and pathogenetically in their natural state, such as minerals, charcoal, lycopodium, were by the newly invented process of trituration, solution, and subsequent liquid potentiation developed into medicines of a remarkable power. Homeopathy, as a practical art, thus become possible, and Hahnemann possessed on, leaving Hippocrates, Galen, and all other competitors to the race far behind. What he is saying? He was the first person who started experimenting on in this way. No one has tried this. Hippocrates, knowing the law of similars, never utilized medicine in such a manner. The Galen, who was knowing the homeopathy but still not worked on this thing, and because of which they never came into existence as a specific person in that specific field, but Hahnemann was the first person who came into the existence because of all those investigations, at the same time experimentation. So what he says, all the other competitors in the race far behind. So Hahnemann passed on. This is very important, and this was all brought about by the invention of simple mathematical scale of measurements. It is so simple that only very few, even it, begin to grasp its tremendous significance. One of the greatest physicists who ever lived, after reflection upon it, said that Hahnemann's theory of potentiation would ultimately lead to an entirely new conception of the constitution of matter. And so it has. Newton's hard massy material atom and even the atom of later physicists is no more an ultimate conception. It has given a place to the immaterial electrical corpuscle or electron, infinitely smaller and more active than the atom. So, Hahnemann reached to such a level where the question of matter was not remaining. What was remaining is the energy. What was remaining is the electron, which is working and because of which the medicine is expressing in an active manner. So he reached to that level where he has saturated or succussed to such a level that it was very impossible to reach to find it out that material inside that medicinal substance. But when given to the healthy human being, it used to produce its action. If it is so, then it indicates that medicine is definitely there, but which is invisible to any instrument. So Hahnemann reached to the level of electrons, what he says, making it smaller and smaller and reached to the level of immaterial electrical corpuscle or electron. Historically, homeopathic potentiation is the development of very old and very common pharmaceutical processes. The mortar and pestle are the old as machine, are as old as machine. Minerals and inorganic substance are commonly prepared for therapeutic use by methods not only closely analogous at its first stage to the homeopathic method, but having their origin in the same fundamental necessity, namely the necessity of rendering such substances soluble, capable of being taken up by absorbents and appropriated by sentient nerves of the living organism. Metals like mercury, the lead, the iron are entirely inert medicinally until they have been submitted to some process, physical or chemical, by which their mass is broken up and rendered soluble, and then their latent medicinal energy thereby set free. It matters not by what name we call such a process, it is essentially a potentiation, and homeopathic potentiation is nothing more or less than a physical process by which dynamic energy, latent in crude substances, is liberated, developed, and modified for the use as medicine. So he is coming to the conclusion of potentiation. Hahnemann came to the concept of potentiation in this manner. He has tried, experimented, making the dose finer and finer and finer. And when he reached to that level where he applied complete knowledge of physics and chemistry and made the medicine so small that it was invisible to naked eyes, invisible to any instrument, but it was persist. And it used to produce its effects when given to the healthy human beings. And it used to produce its specific symptomatology on the basis of law of similars. If you apply, it used to produce a cure. So this method which Hahnemann have invented is ultimately labeled by him as a method of potentiation, later on converted into the word potentization. So this is how Hahnemann reached to the concept of potentiation. It is not within a day. Hahnemann, recognizing that the therapeutic action of the drug is direct opposite to its physiological or toxic action, saw the possibility and necessity of extending this process by perfectly simple, reliable, and accurate means so that it shall not only release the latent energy but render it available for higher purposes of healing by depriving it of its destructive or toxic action, which while at the same time developing its purely therapeutic qualities and broadening its field of action. So here he explained that the method which Hahnemann have developed not only used only for the purpose of palliation, but it started working in the curative purpose. Because once the medicine became dynamic, the dynamic disorders come into the existence, can be treated completely in the same dynamic plane, and patient was getting cured. So the energy which is released after this process, either trituration, either succussion, can be used in order to cure such types of patient, and that aspect he is explaining over there. And to conclude today's session, we'll read one more paragraph. It is perhaps not quite fair to imply that dominant school has not recognized such possibility. So it is not there in old school. That it has done so is evidenced by its attempts to prepare certain morbid products, mostly of animal origin, for use as therapeutic agents by submitting them to the biological process, which may be regarded as somewhat analogous to the homeopathic potentiation. I refer to the process by which various serums and vaccines are prepared. The old-time vaccination, in which the patient was inoculated directly and so-called humanized vaccine virus, represents its first attempt in this direction. So many evils arose from the practice that it was soon discontinued and more modern method is devised. By this method, an animal, usually a calf, was inoculated with pus from fully developed human smallpox pustule. After ensuing disease thus set up in the animal has developed, serum and pus from one of the resulting pustules was again inoculated into another healthy animal to undergo the same and similar organic modification. This process having been repeated a varying number of times through a series of animals and final product was used to inoculate human beings with many technical modifications and extensions. This is essentially a process used today in the preparation of serum and vaccine. The basic idea is so modify a primarily virulent or animal virus, toxin, or other pathological product that it may be used safely for therapeutic and prophylactic purposes. In that respect, it may be considered as crude analog or imitation of homeopathic medicinal mechanical potentiation. So what he is explaining? He is explaining that the way Hahnemann prepared the medicine, the people started working in the same principle. So the first vaccine was prepared by the Jenner, who worked very hard with his sheep and given that anthrax, the collection from the anthrax pustule and prepared and given it to the ships, then their seras were developed and their disease was developed and the serum was collected and that serum was given to a certain group of ships and certain they are kept without that, and both of them he has given the same virus, and then he observed that in those in whom the vaccine was given, they are remain safe, but rest of them where vaccine was not given and given the directly a virus, they died because of it. So this is the product ultimately came out with the experimentation. In the similar manner, homeopathy also existed with the help of many more experiments done by Hahnemann and ultimately came with the sixth edition of Organon. So that's all for today. Tomorrow we'll definitely meet and go ahead with the next part of it. It is a very big chapter, but still we have to learn because we must know all this scientific knowledge with which it is possible to understand the concepts. And today evening we'll meet again and we're going to learn one remedy, that is anthracinum from the Allen's keynotes. So that's all for today. Thank you being there and meet at 8:15. Good evening.
Thank you very much, sir.